My name is Peter Masaba, and I'm the eldest son of the late Dr Irene Gimugu. We're here today to remember her legacy, and one of the things we've done today is launch a booklet about her legacy. My mother was one of the first dental surgeons, African dental surgeons in Uganda, and who took over in the early 70s after the Asian doctors had been thrown out by Idi Amin. And during that time, it was a very, very turbulent period. But my mother, with a few of her colleagues, maintained the mantle of dentistry in Uganda. At a personal level, my mother is a very, very successful dental surgeon, both working for government and working for the private sector. But she left a big legacy of being selfless. Many patients would come to her clinic to be treated, and after being treated, she would not charge them. Because first she felt some people needed to, she was not after money. For her professionalism, felt that some people don't have to pay, they can work for free. And you can imagine it's because of that, that after so many years, 30 years since she left us, she's being remembered. She looked after so many people. She trained a number of, some of the most successful dental surgeons in Uganda were trained by my mother. For me, actually, it leaves a big gap for me. But it also shows that my mother's efforts did not go to waste. Because you can imagine, when she left us, she didn't leave us with much, despite in terms of material wealth. But she left us with education. She left us with so many people who are willing to help us through school. And you can see we are also passing on that. I have also looked after so many children, paid school fees, so many people, I cannot even count how many people whom I've paid school fees for. And it's her legacy. Without her telling me so, it's just learned from her, and you also find out you have to do the same thing. I think there is a certain generation, my mother's generation is different from today's generation. These days, there's a lot of attachment to material wealth. How many cars, how big is the car you drive, how many properties do you have, My mother belonged to a totally different generation who believed in a lot of giving back without expecting anything in return.
Tebananga Peter Masaba. In short, nenga lile ili nbari John Peter Masaba. Pamanyile who access medical care. Kufuna medical care. Shiyangalira abantu bakalibusa. Mundu nga walwalira Maria na meneno ipato enete itembali ale ibusa. Ate abantu besi hamanyire ate ili abantu bari singa tamwidwaliro alika kani bambolere bintu singa kana huulira ta nabona abantu balamumaria yana tya bambole bali ndi bulwali basukali yana tya bambole ndi pressure kene mbulire bubi nabi ari ane kife kuli medical manya kuli singa uamba bulwali buno mangu shiyeta injanjabu wajanjabire mangu iba successful for research tyanga walwalire nabi ari kampu ifaneri isihola shirai ityesi abantu bali watire abantu bali access yaba easier bas arina ni abantu bari nabi bari mwidwaliro na obet ari isi kampu hola yadent ibona abantu babesi balwala yaba linkinga nilidwaliro kale mzee ulwaile bunyabajanjabi pate mwidwaliro ati access yoyo ngulu nabi camp singa tilitsira anomanyire camp nya yaba obuluna bajanjaba balwale ta nenga baile ntwenga abantu babola bari ngote mwidwaliro tyandu banesikani bakubole kale bajanjabe bulai so it's a very good idea.
Sese nabende guga ne chairman LC5 umulonde we district ya Sironko wamakubano ku mukolo gwesi banangirenga chairman bekonga guest ku Dr Irene Gimugu's foundation bakulonshinga scholarships kubona batu baambira ko bana basoma bakenyara accessing kusoma senga chairman obefenga batangirisi ba local government ngambele kuna improving a society zef ngambele kuna improving a district yef inyayachuka konga bana basomera bana bafunye disoma dilai fenge nge government obe district kuni ku cooperatinga kuni government institutions kwaba ni private institutions ne private institutions zaidi na bikukuambira kwefe kugata ku government institutions ze school ni nazo that most times uri olusi bana ba mi private schools ba performing far much better kufotisa government institutions so baba kuambira kwa improving isomarief so cheku kukolano kubona kuti bana befu bali kwa maasiwo bali kusoma ne olusuke bali kunyala kufuna ka school fees bafuniye scholarship kwa mam foundation yo Dr Irene Gimugu so kibakira yiti kuna bani society ndai ingapere society nabendai batangirisi kwa kakulwane kubona kuti kutusawo budambi bulwale ni kuleka kumanya
ya chero kwezera nokina kwini gumukolo gulimo nga gibirini 1 kweni medical camp yekulanga Dr Irene Gimugu Memorial Medical Camp belenga kulukuye dabatu befe Dr Gimugu aba ayagana maibatu ayeda maibatu katana ndirangu wangu musoko makuti the best of remembering paying tribute to her kole medical camp kole batu befe ila kwabe medical camp ya nikilingolobe iyo chalero ila ikagame mugamba then at the same time Dr Gimugu ingesaga na mabi kusoma nase nyangala pamba kumukono asomesa mungeli nendo ina kwa launchingile scholarships kibe kula kuti Dr Irene Gimugu Memorial Scholarship of Merit ila jina kukiranyu kwa makwa ngitongoza mu butongole ni mukolo kwa mukona gwa nina kulicha lero aliyo bagaliwe kwa nini nabo senga Irene pamba kwa pila bandi basigala either they are dead or they amount to nothing because they didn't get opportunity, not because Kiabas, but because they had no opportunity. So for me, Irene taking me has made every difference. So I appreciate God for her, and that's why whatever I'm doing is in recognition of what she did up Ambako, and not because she was very rich, not because she had a lot of money. Like you heard, actually she died when she didn't even own a car, when she even didn't have a land or a building, but she was investing in other people's lives like me. So we are her legacy, and we have to carry on her legacy. That's why I'm doing what I'm doing because of that. One of the things I call it, Queen Scholarship of Merit, Baba Maanza who can come and benefit without discriminating them. It's Bama, their religion, their tribe, their family. But also at the same time, we have a closed scholarship for family members. Family, Bizukulu, Bisoni, Yosi, Okabatero, and for them it's not whether they are bright or not, but we want to give them opportunity. So that's what we're trying to do. We want to create the one maybe Mugamba now they will help other thousands of other children. We are blessed to have over 10 doctors and over 10 nurses, clinical officers, and so we have been treating a number of conditions. We are doing a lot of investigation, like investigating, pressure, sugar diabetes. kuli x-ray, kuli scan for most of those abdominal conditions, kuli screening ya cancer, cervical cancer and the prostate cancer, and then of course the common conditions like typhoid and malaria. Then many of our people just had skin conditions. We are handling many of the skin conditions and a lot more cases as they come. We've been also doing some procedures. We have booked some people for operation, especially cases like hernias. We have, I think we've had about 5 have been booked, and we are going to take them somewhere to a convenient place and they are going to be operated. Oh. Yes, we are working with World Health Center. We are working with our ALOS Center 4, which is in Buwasa, in coordination with the office of the district health office. Okay. Batubefe, Vibogiso, Masabaland and Uganda as a whole, I appeal to you to emulate this kind of thing as much as you are able. Ngawasobole ngawera aliko nesa akuyedere akutere kebulira batu bandi kebulira batu befe batu bali yasi batu bali nyuma. You may make the greatest difference in their lives. Yeza obambeko mukono ubinyuse. Together we are going to make a difference in our people.